I'm Dr. Angie Stoehr, and this is Feminine Curiosities. One of the things that I deal with fairly often in my office is pelvic pain. And a really common complaint with pelvic pain is discomfort in the what we call bilateral lower quadrants, or about where you think your ovaries might sit. I will tell you, many women think that this pain is indeed coming from their ovaries. It's usually a tugging, pulling sensation, sometimes a stabbing or like a deep ache or a very deep burning sensation. And it's a little hard to describe. It's a little hard to locate. It's kind of just like down there on the lower sides. It can be associated with any number of other different symptoms like diarrhea, constipation. It can be associated with bladder dysfunction, stuff like peeing too often or being unable to void completely. The classic thing that I see coming from this specific pain on the bilateral lower sides is pelvic floor dysfunction. Now, let me give you a little bit more of a broad issue with this. Your brain is actually really bad at deciphering where pain signals are coming from in the pelvic area. Everything from like your belly button to your mid-thigh, more or less, front, back, inside, outside, organs, all the way up to the skin, is covered by a big jumble of nerves in your pelvic area. That jumble of nerves takes a long time to bother getting up to the spinal cord, and when it does, there's only a couple of spaces on the spinal cord for that information to get fed in. And so the information from that whole region kind of gets like overlaid and batched up together, and then it finally gets sent from the spinal cord up to your brain. The major relay station for pain in the brain is called the thalamus, and your thalamus does not have any topography for your pelvic region, which means that when signals for pain from the pelvic area get to your brain has no idea where they're actually originating. And I've seen some really weird ones. One of the most unusual ones that I've seen in my personal practice was a patient that had hip pain in her left hip, and it was persistent. She'd had it x-rayed, MRI'd, CT scans. Nobody could figure out what was causing her hip pain. And when she came to me actually for an unrelated issue, we got to talking about the fact that she was having pain. And so I did a more thorough exam and found that she actually had a little bump or a little ball of nerves at the edge of the right side of her cesarean scar. Long story short, we eventually figured out that that was an endometriosis implant. But once we removed that, the hip pain went away. So her brain was so confused that it isolated pain to the hip when it was actually coming from the opposite side of the body from the skin. So no joke, we see some really, really weird stuff in the pelvic region. So when you're talking about pain that feels like it might be in your ovaries, oftentimes it's not actually coming from the ovary. In fact, I would say probably only about 20% of the time that I see a chronic pain issue, we find anything wrong with the ovaries, and that's including stuff like endometriosis. Now, there may be endometriosis growing on the ovaries, and that's potentially a source of pain, but usually the pain's actually originating elsewhere, most commonly the pelvic floor muscles. Now, your pelvic floor muscles are basically a nice little hammock. That hammock has 3 holes in it. One you pee from, one you poo from, and one you have sex with. So when anything in your pelvic region is hurting, your body's natural reaction is to clench. That's why when you like hit your thumb with a hammer, you don't go, oh shoot, that hurt. You grab it with the other hand, right? When your stomach hurts, you clench around it. So when your pelvic floor is clenching, it can be in response to pain from elsewhere, which often it is. It can also be your body's natural reaction to stress. Some people carry their stress in their shoulders and their neck, and it causes headaches. A lot of women carry their stress in their pelvic floor. They cinch it up, and then it causes pelvic pain. So that nice little hammock with the 3 holes in it, when it starts getting like cinched up, it causes this discomfort. And the sharp stabbing pains is actually when that thing is spasming, often. The thing about this is your pelvic floor is kind of an unusual muscle. I like to think of it like your diaphragm. Your pelvic floor muscle is a subconsciously controlled muscle with conscious override. So like your diaphragm, it breathes all day and all night for you. But if you want to, you can override it and take a deep breath. Yeah? Same thing with your pelvic floor. it keeps a nice little natural tone so that you don't leak pee and poo all day long, for which we are very thankful. But you should be able to sit down on a toilet and relax it to pass stool, or in a bed or anywhere else in your house, relax it to allow something to penetrate. When your pelvic floor gets too tight and it stays that way for a long time, either due to stress or due to a response to something else hurting, it resets the tone of the pelvic floor too high. When that reset pelvic floor tension gets too high, now if it's stimulated by the wrong movement, by coughing or sneezing or something, or being poked around at with any number of objects like a toy or a finger or a penis, it may spasm. And it's just like muscle knots anywhere else, or like a Charlie horse in your leg. Gosh darn it, that hurts. So the pelvic floor pain can be this like chronic ache from muscles that are too tight, with the occasional stabbing pain from a spasm. The other really interesting thing about this like achy sensation that you get from non-relaxing pelvic floor dysfunction, which is the sort of technical term, is that once your brain resets that tone too high, it starts forgetting how to function properly. Patients with non-relaxing pelvic floor dysfunction, when I do an exam, a digital exam, I'll place my fingers inside the vagina and then ask the patient to contract their pelvic floor, and they'll relax it instead. And vice versa, you tell them to relax and they'll cinch it up and actually pinch my finger between their vagina and their pubic bone. So all of this can be taken care of. It is something that is very treatable. It does take quite a bit of work on the patient's side to be able to get back towards something normal, or at least something tolerable. Usually we get involved our wonderful pelvic floor physical therapists who are well trained at taking care of this. Sometimes it involves use of dilators, which I will cover in a separate video. It's kind of its own little ditty. And sometimes it involves the use of things like near-infrared lasers, certain types of injections. We can even use Botox into the pelvic floor. So sometime I'll give a nice little video on treatments for non-relaxing pelvic floor dysfunction. But at this point, know that that aching sensation down in your pelvic region, probably not your ovaries, much more likely to be a muscle thing. If you ever are having chronic pain in your pelvic region that sounds like this, I would recommend going to your gynecologist, who can refer you to a pelvic floor physical therapist, or researching for a pelvic and sexual pain specialist in your area. You might think that that would always be a gynecologist, but pelvic floor specialists or pelvic and sexual pain specialists can come from any number of specialties, including urology, gastroenterology, obviously gynecology, which is what I do, but also PM&R docs, or physical medicine and rehabilitation. So research a little bit, find somebody in your area. If you can't, fly on down to Dallas and see me. I'm happy to have you in my office. Again, if you like my videos and are interested in hearing more, make sure you subscribe, hit like down here, and you can always access my videos right here at Feminine Curiosities.